This is Starting Point, a podcast that tracks Guyana's unprecedented growth from all vantage points. Join your hosts, Kiana Wilberg and Fariza Hanif, as they dive deep into the heart of topical issues.
Hi, welcome to Starting Point. My name is Fariza Hanif, and I'm joined by my host, Kiana Wilberg. Today, we have a guest who is regarded as an expert in his field and someone who is in quite demand in the country, Dr. Mahendra Carpen, the head of the internal medicine and cardiology at the Georgian Public Hospital. Dr. Carpen, welcome.
Thank you very much for having me. It's a pleasure being here.
We're happy to have you as well. Now, I want to get right into the discussion. And as I introduced you, you're widely recognized as Guyana's leading cardiologist, and you have quite a demanding career. And now you're in the field of politics, even more demanding. And I want to really understand what motivated you to step into the political arena and to throw your support behind the PPP.
Well, again, thanks for having me here. Whatever I have been able to accomplish in the field of cardiology, I think it's only fair that I recognize my team members that have stood with me, not behind me. They've stood with me along the way, and those who would have played pivotal roles in training me and getting to this point. So whatever accomplishments stand now, it's because of the team that's been backing me all these years. And I see the step into politics as just an extension of service. And it's you serve your country one way, you can serve it multiple ways, and you can do them at the same time. And I believe my role and service now is to help re-elect a government that I believe is taking the country in absolutely the right direction when it comes to healthcare and many other aspects of nation building. So that's my reason for stepping in.
And if I may, Kiana, I mentioned that both careers, so to speak, are demanding. How do you find the time to manage on the campaign trail and to manage all that you've been doing at the Georgian Hospital, in addition to the clinics that you have at the private hospitals too?
Yeah, I've always heard, and I believe it's true, if you want to get something done, give it to somebody who's busy.
Right.
Because it's about time management, and
Correct.
that's a cultivated skill. And sometimes it's a struggle, but we still try to get it done. And it's a special task sometimes to prioritize and to see what comes first. In the field of medicine, that's one of the unique things in your training. You are trained to prioritize, triage, and put the most severe issues at the top and then deal with that first.
But Dr. Carpen, I want to talk a little bit about politics, because in Guyana, politics and perhaps anywhere else, it's not for the weak. And coming from a background where you have the power to affect change, you have the power to run a diagnosis, you have the power to help people in the immediate term and provide a long-term solution. And politics, it's not always so clear cut in that dynamic. Sometimes the wheel for change takes a bit longer to slow. Are you prepared? Have you prepared your mind for that dynamic? That's one. And two, now that you're in this vantage point as a budding politician, I'd say, what's your take on the political landscape? So two questions in one.
Guyana is very interesting in terms of its politics. And you mentioned the power to effect change. Power is a responsibility, and you can step up and accept that responsibility to make the changes that you want from the inside, or you could stay outside and complain and criticize. But I've always been impressed a long time ago by a speech that President Roosevelt would have given at the Sorbonne in France, when he talked about the man in the arena. And that's the guy you want to be able to lead things and to be able to effect change. The one who's willing to get there and to get dusty, to get dirty, to take the licks, and even the criticism from those who are in the stands high up. And, it's an impressive thing It's daunting, but you have to be able at some point to put your fears and timidity aside and to do what you believe is right and what is correct. And at this point, I believe that the trajectory in which the country is going and the rate at which we are growing, it demands a continuation of current leadership. And to deviate from that, I believe would be catastrophic for our growth and development. You talked about long road towards change. But if you were to look at the previous 5 years, the accelerated pace of growth, there is nothing slow and tedious about what's happened in the last 5 years. We have seen remarkable progress in all areas: health, education, economics, infrastructure. The rate of growth, the scope of growth, it's just phenomenal. It hasn't been seen anywhere else. And I believe, you can now get in, make a difference, ensure the country continues on the right path, or have regrets that you did not.
But you're on the campaign trail, and thanks for that response. And you're on the campaign trail, and now you get to see politics through a different lens.
Yeah.
Once you were, on the sidelines, just like the rest of us who were not in the thick of it. Now, how do you view the political landscape?
Yeah, I'm a bit of a nerd, so I kind of study everything.
Mm-hmm.
Human behavior, human nature doesn't change regardless of what field you're in. People are competitive by nature, and the strongest ones often are the silent ones. And in this country, we have a lot of very strong people who are not as vocal as some of the rest. You just have to be able to tap into where the strengths of the country are and to be able to move in that direction. The silent majority are usually very reasonable, sane persons who believe in the core principles of a country moving together as one. The reason you asked earlier why I chose the PPP, it is because not only of the current leadership, but the principles and foundations upon which the party has been established and built. I take pride that the founder of the People's Progressive Party is a Barbadian like myself, Dr. Jagan, and the core principles were based on democracy, unity, and equality. I believe in those because without those core principles, we can very much easily run astray as a country.
Right. So you're talking about some of the principles you admire, and also on the campaign trail, you mentioned that one of the things you were most impressed with is the progress in Guyana's healthcare, unmatched when compared to anywhere else you've seen or you've worked. But what are some concrete examples that took you to this conclusion?
Yeah. So my experience has taken me across North America and the Caribbean, and that's, what I choose to be involved in. And yes, there are countries with larger populations and greater resources. But when I talk about healthcare development, it's the scope of what's happening, the sheer grandeur. Mm-hmm. There's no other country anywhere in the Caribbean, for example, that would have done 12 new hospitals in such a short time. There is no other country that has invested and seen fruits in training of healthcare professionals in such a short time. I'll give you an example. I'm part of the Georgetown Hospital, and part of our responsibility there is to teach. When I came back to Guyana in 2012, we started a training program for internal medicine around 2013, 2014. In about 10 years from then to now, that training program for internal medicine has moved on to create subspecialty. So from internal medicine now, we can identify and send people for training for gastroenterology, That's for the GI system. We can send people for pulmonology, that's the lungs, for kidney specialty, for cardiac specialty. All of that happened in a short time. And within the last 5 years, that has accelerated. Not only are we doing the internal medicine, we're doing the subspecialties now. And the latest evidence of that is the acceptance of our cardiology training program at the University of Guyana to commence sometime early next year. These are all developments that are happening, and it's not, just happening at a central level. Everyone is allowed the opportunity to make their contributions, and people generally allow you that freedom so that the locals who have the relevant expertise, you can put it to use.
Now, you mentioned the scope of the expansion, and obviously there has been transformation in the healthcare sector in 4 years, I would say. Now, with that comes the shortage of healthcare workers.
Yeah.
How do we address that?
So that's a very, very significant issue. And I believe we're not alone in that boat. All across the world, there's a shortage of healthcare workers. And one of the things that revealed that, ripped the scab off of it, was the COVID-19 pandemic.
Correct.
And the way we will address that, and we have to address it, is by training. Now, I've been to places where the healthcare workers have been trained in the non-traditional ways. For example, one of the most successful heart surgeons in India, in South India, his main assistants, the nurses who assist him in the operating room, are not people who went to nursing school, but these are people that are indigenous to the village where the hospital is. He found them, these are housewives and moms, and said, listen, come, I will teach you a skill to be my assistant in the operating room. They have basic comprehension, but their skill level in that particular specialty is unmatched. Like anyone else who would have gone through the formal training programs. Now we have a lot of people in this country who may not have the requisite 5 subjects or A levels, etc., to get into formal training programs. But I guarantee you that we have the opportunity that should anyone want to be trained in any specific field, we can make that happen. And I don't believe that we have a situation where people are looking for jobs and looking for opportunities and can't find it.
Now, I'm sure you'd have had a chance to examine some of the plans that the opposition has for the healthcare sector if they're elected to office. What are your thoughts on that compared to the plans of the PPP?
I started looking at what was released as a manifesto, and I'm not going to comment on any specific one. And halfway through, I had a feeling it sounds very familiar. And when I actually glanced at the thing, it's basically a reproduction of what's currently being done. There's no originality, there's nothing new, there's nothing groundbreaking. And I commend them for making an effort to put stuff down in writing. I'm sure it's not an easy task, but essentially what the newer parties are asking is to say, okay, the government is doing this, but we can do it better. But they don't have a history, a track record, nor the expertise to do it at the foundational level, much less to do it better. So they'll get A for copying, but
so they just want to build on the foundation that was laid.
Yeah, it's like, okay, I'm going to give you let's say government gives you $1, say no, we'll give you $2, and it's basically the same thing.
Okay.
Dr. Carpen, the prevalence of cardiovascular disease in Guyana is one of the highest in the Americas. What do you see as some of the challenges on the horizon which you hope to address through political action?
Yeah, so that's a significant problem, and thank you so much for bringing it up. That's very near and dear to my heart, no pun intended. But yes, cardiovascular disease across the world is the #1 cause of death. and it's much worse in our population
Mhm.
for a number of reasons, some of which you can change and some of which you can't change. The things we can change are like, stop smoking, exercise more, have a healthy diet, early screening for diseases such as diabetes, hypertension, bad cholesterol. The things we can't change is when you're getting older, you can't change your age, you can't change your gender. Males are more likely to have cardiovascular disease, and we can't change your ethnicity. Persons of South Asian descent are at much higher risk for cardiovascular disease. But the things that we can change, we have to have programs in place to change. So, for example, if we had to create policies, I believe we should have early screenings done for these chronic diseases. Across the world, people tend to recommend screening at age 40, 45, 50, etc. But I can tell you that what I have seen in just 12 years of practice in Guyana is very astonishing. Let me be specific about that. When I first came back, the average age of the heart attack patient was in the 50s and 60s. Mm-hmm. Now we're seeing the 30 and 40-year-old, and this is 10 years. It could be that we're recognizing them earlier. We have a lot more healthcare workers who are sensitive and aware of this problem, but it's still frightening that we're having people at this young age coming in with severe cardiovascular disease. And still, 1/3 of people coming in with massive heart attacks to the hospital are now, for the very first time, finding out that they have diabetes. Mm. So what it means is that we don't have proper screening. And culturally, we generally have been waiting until we get sick to go to the hospital. So part of the programs that we will be advocating for is early screening. And I believe that the Guyanese population should have screening sometime between the age of 25 to 30, where it involves things like height, weight, blood pressure, diabetes check, mm-hmm. cholesterol check, all of those things that you can do something about, the social habits, smoking, vaping, recreational drugs, etc. We screen people at an early age, we put them into a risk profile, and then we determine what are next steps based on what is found at initial screening. These are the ways in which successful healthcare systems across the world have managed to reduce their burden of chronic diseases. They haven't eliminated it, and I don't believe we can eliminate it totally at any time in the near future. But again, while we build on the elimination or the preventive aspect, we also have to have a program to address those that could not have been prevented or those that already passed that stage, because there are going to be a significant number of persons, significant percentage, regardless of how much screening and regardless of how much preventive measures, you can't change your genetics, and they're going to have cardiovascular disease. So you have to develop a robust tertiary interventional type of healthcare system to deal with those people as well. And I believe that that's what we're doing at this point with all of these new healthcare facilities that are being built by government. The one in Amsterdam, for example, is going to have cardiac interventional suites. The one that are planned for the West Coast at some point is also going to have those facilities. So patients from Berbice and Essequibo on the West Coast, big population centers, when they get an acute emergency, they don't have to wait on an ambulance to come to Georgetown to get the care. Because oftentimes, that results in bad outcomes. We have a saying in cardiology that time is myocardium. Myocardium is heart muscle. So the longer you take to intervene, the more heart muscle dies. Correct.
And Dr. Carpen, you touch on two things that are very near and dear and something I wanted to talk about as well. Young people and vaping.
Yeah.
Are you seeing more cases of illnesses that are linked to vaping? And you mentioned more young people are now being diagnosed with certain diseases. Is there a link there that you've been able to identify?
Yeah, so there's international work, not just Guyana, that recognizes the absolute link between vaping and those habits with adverse cardiovascular outcome. Even the straight vaping, it has the effect of increasing heart rate. It has the effect of increasing inflammation inside the blood vessels. And when there's inflammation, clots form and can block up vessels and cause heart attack, stroke, all kind of stuff. These are just the major ones. And it also increases blood pressure, so from an acute stage, that is what it does. Now, oftentimes, the vaping and whatever substance they use, they season it and they add stuff.
Correct.
And, for a while, I believe, things like cocaine and all of that, much harder, much more dangerous stuff gets mixed in with vaping substances, designed either to create a higher sensation or also to create a dependency syndrome for recurring customers. So I'm absolutely against vaping. I've seen people vape as a bridge to ceasing or stopping tobacco smoking, which it can work, but I'm against vaping. I'm against tobacco consumption.
The long-term effects are
The long-term effects are very harmful.
Dr. Carpen, you also mentioned the prevalence of cases linked to recreational drugs, and that has been deemed a worrying trend in Guyana. Can you talk a little bit more about that?
Yeah, so recreational drug is what people use generally in social circumstances or by themselves to create a different mental state. And it goes from cocaine, heroin, ecstasy, all of those stuff. And some people consider consumption of alcohol as well as recreational drugs. These all have adverse effects on the human body. None of them are exempt from these harmful effects. And, they create dependency, they cause social disruption, but they also cause physical harm to people. And the physical harm is from head to toe. Men in particular should be cautious because they're at higher risk for things like erectile dysfunction. And I found that argument sometimes work a lot more effectively with men as a preventive tool.
Correct.
But the converse is also true. Women tend to have worse cardiovascular effects. So women would be able to tolerate less alcohol, less cocaine, less vaping. Your system is not built really to tolerate the same doses as men. So the effects on the end organs, the heart, the kidneys, the brain, are much worse.
So, Dr. Carpen, I want to take you back to a question that we touched on earlier, and that is the pace of development in Guyana.
Yeah.
I wanted you to just touch a little bit on what have been some of the critical investments over the years in cardiology to improve and decentralize patient care.
Yeah. So one of the things I could talk about with full knowledge is the way in which cardiovascular health has changed in this country. I think we're at the stage now where we're probably the envy of our neighbors in CARICOM when it comes to acute cardiac care. A patient with a heart attack, once you make it to the Georgetown Hospital, you are guaranteed standard of care, state of the art, the same that you would get if you were turning up at a hospital in London, New York, Canada, etc. Whereby in the emergency room, you'll be assessed, the cardiology team is called, patient is admitted, and you will get your angiogram, stent, pacemakers, whatever it is that you need in hospital before discharge. And we do this at no cost to the patient. And let me repeat that just in case there's any misconception. The patient pays nothing when you come through the Georgetown Hospital emergency room. Of course, there are private patients and stuff, that come at different points to institutions like Caribbean Heart Institute and private hospitals, Woodlands Balancing Hospital, etc. But the Georgetown Hospital, through a series of interventions from the Ministry of Health and the Georgetown Hospital, we have been able to provide that care for some time now. When I first came back, we were able to do like 50, maybe 60 cases per year. And those are people who can afford it, or there's a lengthy process of approval.
Mm-hmm.
That slowed down tremendously. And then within the last couple of years, we are now doing north of 600 cases per year. Now I have more assistants in my department. I have trained specialized nurses. I have more interventional cardiologists. I have clinical cardiologists. I have a full-fledged team in Georgetown Hospital that allows us to be able to provide this level of service. And the good thing about it is that there is not a waiting time, and patients don't have to wait for an approval process once they come through the hospital. As I said earlier, time is myocardium.
Mm-hmm.
If you delay in managing these patients, they're going to have worse outcomes. And worse outcomes for the healthcare system too, because if the more heart muscle that is damaged, the more that patient is likely to develop heart failure and have recurring admissions to hospital, need more medications, more resources, etc. in the long run.
Mm-hmm.
Dr. Carpen, to close, and I know that we've touched a lot on the important interventions being made to take Guyana to the next level, as well as the pace of development. But what's your message to the electorate as they assess the respective parties and they gear to make their decision, put their X on September 1 for close of polls?
Yeah, it's an important decision, and it's a privilege and a right that everyone in this country enjoys, and we must take that seriously. And I believe in considering all factors, one needs to assess who has the best ideas, but anyone can have an idea. You must have a plan to bring that idea to fruition. And then to top it off, you must have a track record of having achieved your objectives. And when we look at that in totality, there is only one real choice at this point, and that's the People's Progressive Party. With a track record of achievement, a vision of taking this country to the next level, and the freedom of allowing the experts and the professionals to have a voice in developing the health sector. And these are some of the reasons why I personally endorse the PPP, why I admire the leadership in the way they are taking this country, the direction that we are heading in, and the pace at which we are going. Of course, when you're moving faster, sometimes, a few things are not done perfectly, but that's to be expected. We recognize it, we fix it, and we move on. It's better to do that than to be on the outside and complain and jump and make noise about it. So if you want to fix something, you get there on the inside and fix it.
Dr. Carpen, thank you for providing really crucial insights today on a number of important issues regarding Guyana's health sector developments we've seen today and the importance of cardiovascular health. I know that our audience has learned quite a lot, so thanks again.
Thank you so much for allowing me the opportunity. Appreciate it, and wish you all the best in your future shows.
Thank you so much.
You.
Right.
And I hope our young people listen. Vaping is bad for you.
Indeed.
All right.
So, to our audience, a thank you as well for joining us. Please be sure to follow us next week, same time, same place, as we bring you more insights regarding developments in Guyana from all vantage points.
Thanks for watching Starting Point. Follow us on Spotify, YouTube, Facebook, Instagram, and LinkedIn for critical updates and exclusive content.